And we are ever so happy today because you are 26th batch coming into our college. You already came. We congratulate once again for choosing this noble profession, and we congratulate more
dignitaries on the dais, students, faculty, other staff, and of course, freshers. Welcome to SVS. Congratulations for electing this profession, and also, as my brother said, choosing SVS because it's a wonderful place and you're going to be very successful in your life, in your career and your profession because you chose the right profession and the right college. As Dr. J Reddy said, even I remember my first day, 1st October 1980, because I came from a rural background, though I studied in Nagarjuna Sagar. And coming to Usmania Medical College, those days was one of the biggest medical colleges. We did not have so many. We had only 3 in Telangana, probably 3 in Andhra and 2 in the Rayalaseema. So getting into medicine was a big thing. Of course, even now it's a big thing. We had to work very hard. I'm sure you realized. And I was very reluctant to talk to people because most of the people come from Leaky Flower and all posh colleges, schools. I wasn't sure because my English was not good. So we had a group of people to improve our English communication. So we used to listen to BBC radio those days. We just started. So listening to the conversation, we picked up. Why I am saying this? Because Vijayaragam said, communication is the key for your success. To be a good doctor, you have to be a good communicator. Communication not only with the patients, but your colleagues, your teachers, even with the parents. That makes all the difference. It's not how much knowledge you have, it is how well you communicate with people. That's more important for a successful profession, successful doctor. And as Vijayaragam said, do you know which is the most important subject in your medicine? Because every subject is very, very important. And you already spent 6 months. I'm sure you realize because from intermediate to medicine is a big change. Everything is new to anatomy, biochemistry and physiology. But these are the subjects which will form your foundation to become a good cardiologist or gastroenterologist or a neurosurgeon or a urologist. You need these subjects. You need good anatomy knowledge, physiology background and biochemistry. And even now we keep referring to anatomy books because we have to know where the important structures are. When we are operating, why do you do dissection? Because when you are operating on a particular part in the abdomen or wherever, you have to go through safe zones so that you do not harm the patient while operating, doing a surgery. So it's very, very important. You have to know all the important structures. Then only you can save these important structures to do the operation. Similarly, physiology and biochemistry. So you have to work hard. These basic, we used to have about 18 months anatomy, physiology. Now it's cut down to 1 year because your course is reduced to 4.5 years. So it's more important for you to focus on these subjects. And of course, research and technology is the key. We understand from the counseling that we get good students because competition is high to get into SVS. I'm sure you realized in counseling. So you already have very good knowledge, acquiring knowledge, ability to acquire knowledge. So you should focus on this specialty of research and of technology. And previously we used to think only teachers and faculty will publish. Now there's so many students of SVS who published papers in listed journals and published books and chapters, as J said. I think one of the previous batch, he wrote a textbook of medicine for UGs. One of the students wrote pediatric textbook. So it's need not be acquiring after becoming a faculty or a super specialty, you have to write. Even now you can focus on writing, because writing helps a lot, publication, because you have to do a lot of homework. You can write in anatomy, physiology, biochemistry, little, your whatever little research, you have ability and facility to do research and find out which is the easiest way of doing things. So publication brings you a lot of knowledge, because you have to do a lot of homework to publish. That's important, because that keeps you ahead of the rest of the people. And of course technology, you have to integrate technology. If you go away from technology, I'm sure you're very good, much better than us, because you're very good using mobiles and other electronic gadgets. Previously this information was not available. We used to get from textbooks and very difficult to get any information. Nowadays it is there in your hand, provided you use the right way. So much of information available on the internet and digital data. So you have opportunity to get this information for a good purpose, to become a good doctor. And of course you have to be a good person. I keep saying, you have to, keep saying ABC. ABC is, in medicine, is airway, breathing, circulation. But in profession, A is attitude. Your attitude is very, very important, because attitude towards yourself, towards patients, towards your colleagues, towards your parents, and towards your teachers. That makes a big difference. And your behavior, the way you dress, the way you speak, the way you wish people. And of course, the last one is communication. Ability to communicate well will make all the difference between you and the rest of the people. And Joshi was saying, SVS students are everywhere. If you take Hyderabad, every corporate hospital has got SVS. And they were taken without much hesitance, because they know doctors from SVS are well trained. They are quite competent. They are quite caring. Their abilities are much better than most of the people. So you already reached that level by joining SVS, and you should prove yourself better by getting better yourself. So I think, and the last one, most important thing is, you must look after your health. That's most important thing. Unless you're healthy, you can't train yourself, you can't look after your patients, you can't do more majority of the things. So looking after health is very, very important. You must spend some time in your physical activity, keep yourself healthy. And quite a few people, significant number of people in medical profession suffer from mental health. So do not hesitate to consult doctors or specialists if you have any medical problem, especially related to the stress and mental, affecting your mental health. Do not hesitate, because it's very, very important to keep yourself healthy to become a good doctor. Thank you once again. Wish you all the best.